Hi, this is for nasal tracheal suctioning, so we are going to check the patient's chart, make sure the order is in place. Then we're going to make sure we have our supplies. We have our sterile nasal suctioning kit, and we will head to the patient's room. Hello, Mr. Blank. My name is Trisha, and I'm with Respiratory Care, and today we're going to do some suctioning. You have that airway placed through your nose, so sometimes that makes it difficult for you to get your secretions out. So we're going to use a little catheter to go into the nair and get some of those secretions out for you. So first, can I verify your name and date of birth? Okay. All right, so the first thing we're going to do is we're going to give you some oxygen. So we're going to what we call hyperoxygenate the patient. We are going to check the patient's vital signs, listen to his breath sounds, and then with this procedure, we want to leave the pulse oximeter on at all times because we want to monitor that throughout the procedure. So we will leave that on his finger, visible where we can see it, and then we will prepare our kit. So we're going to open up our suctioning kit. We're going to put some lubrication. Actually, we're not going to touch anything. We're going to have it open and then put our gloves on first. We're going to try and keep one sterile hand and one clean hand. And then once we have our gloves on and in place, we're going to use the lubrication and put some on somewhere on the sterile kit so that we can utilize that. And we are going to pull our suction catheter here. We have our suction connected to the wall. It is at -100 to -120 for this adult. So we have the suctioning connected to the wall. And then we're going to make sure that the suctioning is working correctly. So we're going to have some sterile saline in our kit here. We're going to have that available. We are going to put our catheter tip into the saline, and we're going to occlude the thumb port. We're going to watch that the saline comes up into the catheter to ensure that that suction is working correctly. So we have done that, and then we are going to lubricate the end of the tip as well as we can with that lubrication. So we've got that there. Okay, and then we are going to remove the oxygen from the patient. So Mr. Blank, let's go ahead and take that oxygen off here. And then I'm going to use the catheter into your nose. You're going to feel a little bit of pressure, and it's going to make you cough a little bit. All right, so then what we're going to do, without occluding the thumb port, we're going to put the catheter tip into the nair, and we're going to slowly progress with that until we feel a first resistance. Patient will cough, or that may cause cough. We're going to push a little further. Second resistance, we're going to pull back slightly. As we pull back, we're going to occlude the thumb port. And then we're going to start twisting that catheter. So as we're twisting that catheter, we're pulling back. We want this with the suction to be less than 10 seconds, the entire event to be less than 15 seconds. As we pull back, we're getting secretions into the catheter. Pull that all the way out. And then we are going to oxygenate the patient again when we're finished. So Mr. Blank, I'm going to go ahead and put some more oxygen on. Go ahead and get that oxygen back on the patient. Go ahead and get rid of our catheter. And before we started, like I said, we wanted to assess those vital signs. So once again, we're going to assess those vital signs. Listen to the breath sounds, kind of feel the chest to make sure that we've gotten rid of all the secretions that may have been present, and monitor that oxygen level. Then we are going to discard all of our supplies. Go ahead and remove that oxygen again. Make sure Mr. Blank is comfortable, that he doesn't need anything. Reposition him to where he was before, so he's, like I said, he's comfortable. And then we're going to document everything that we've just done. Thank you.